Hi, am I on?
Yeah.
Welcome to Facebook Live. I'm Dr. Annette Mercatante. I'm missing my co-host Justin as he fights the frigid ice. So today we have Elise Nichols here to assist me and to answer your questions. So let's get right to the data so we can get right to your questions. We are now officially at 8,424 total cases, with over 6,000 recovered and 233 deaths. The good news is our case positivity rate is down below 5% at 3.7%, and we are still testing at a robust over 300 per day, which is pretty good. We have 101 new cases average since last week. This is our graph, and you can see that we're coming down nicely. We're still hovering around the peak of where we were in March, but the steady decline of new cases is very encouraging. And then we have, this is our testing positivity. You'll notice that testing positivity still looks high because that's the total positivity since the very onset. But our case positivity average for the week is, like I said, 3.7%. So what's more helpful here is to see how we can see these testing ability is staying strong, and we still are able to test a fair number of people every day. And we could certainly increase that, getting back up to here very easily. So as need be, we can ramp up our testing very effectively. And then this is our data dashboard, part of it for our vaccines. You can see that roughly 50-50 of our vaccines now are going to second doses, which you'd expect at this point. Everybody that got first doses through January is now into their second dose phase. And we're not having any difficulties getting second doses. However, we'll talk probably a little bit about that. It is important to remember that you should seek your second dose where your first dose was received, because the providers are given second doses based on how many first doses they received in the first place. So we don't have a second dose for you if you received your first dose in another county or even with a different provider. So just keep that in mind. And then our dashboard, which we'll continually try and update and keep you informed. And I believe there's vaccine information on there as well now, is there not? Total doses, or we?
Michigan/coronavirus as the state's data
Okay.
dashboard.
All right. So Michigan coronavirus dashboard has the state counts for vaccines. So let's get to your questions.
All right. So our first question was a pretty common one. When will I get contacted for an appointment?
So as you know, we put in the new Everbridge system last week. I'll just say that we have 11,693 people who've registered on this system. And for those over 65, it's close to 7,000 individuals. 6,833 is last I looked. So a lot of people now registered. All those people clearly can't get vaccine. We continue to receive about 1,000 first dose vaccines a week. I truly hope that will change over time. That's completely out of our control. And so if you do the math, even if we provided that full 1,000 vaccines to the 65 and older, it would take us 6 weeks, 7 weeks, even 8 weeks to get to everyone. So you're going to have to wait. Now, we don't always allocate all of the vaccine we receive to 65 and older. We continue to have priority groups like first responders, healthcare workers, and child care workers that were still teachers that were still trying to get vaccinated. And so we continue to just try and balance that with the total volume. So the simple answer is you will get notified in the order to which you've registered. And that will be somewhere between now and March. No, excuse me, April. Depending on how much vaccine we get.
Mm-hmm. That leads into the next question, Doc. Is St. Clair County different than other counties in their vaccine allocation, or are other counties struggling with vaccine supply as well?
We're all in the same boat. I'm on calls with my colleagues virtually every day. Counties our size 150 to 160,000 or so, we are essentially receiving the same amount of vaccine. All of us are getting about 1,000 doses. Now, some counties have hospital systems that are receiving extra vaccine as well. The hospital systems do receive their own allocations and distribute them according to their plans. Our hospital systems are not receiving a great deal of vaccine. And that is why, and they are busy doing their vaccination process internally with their own staff. So, no, I don't think we're unique. I think the problem is there's way more people who want vaccine than the vaccine that currently exists.
All right. And then we had another question. How are priorities ranked? Is it by age? So we've gotten a lot of questions about folks who are 65 plus. Are we going to prioritize those who are maybe 75 plus or those who have underlying conditions?
And that's fair. There are some communities that did that initially. They started with the 80 and older or 75 and older and have worked their way down. About 2 weeks ago, we discussed that internally. And we felt that since we started the process at 65 and older and already had, and already vaccinated a fair amount of 65 to 75-year-olds, that it wouldn't be really right to pull back at that point and change our rules. So we just kept it at 65 and older, which is consistent with the state's guidance of what they want us to do. The state guidance also doesn't direct any sub-prioritization within that 65 and older group based on health care issues or comorbid conditions. And you could consider that. And I've talked about this before, but as the health officer, if we had to decide on a group of 7,000 people, which health conditions would warrant somebody to get in front of the line from somebody else, I just see that as a mind-boggling, difficult problem. I just don't see how we could make it fair. I mean, do 3 health conditions outweigh one really bad one? Or, how do we do that? And there's just not enough information in the literature to really guide us with that. Anyone over the age of 65 is at higher risk for serious complications of COVID, even if they're healthy. So I think we're just going to stay the course and do the 65 and older and just work our way through and try and engage as many community partners as we can, so that we can do this equitably, and we'll fight for more vaccine every week, trying to fight for more vaccine so that we can get this done.
All right, so there were a lot of questions about the pre-registration system, so let's rattle off a couple of those. This next one, my husband and I share a phone number and an email. The notification we got for an appointment did not say who the appointment was for. Will this be fixed in the future?
There are a lot of glitches in this system. We went live, we expected, and it was working well for registering people. If you have gone on and created a user ID and put your information in, we have it. We have it and we have access to it, and we will pull your name when appointments are available. But there's a lot of glitches like that are there. And yes, we are aware of them. And yes, we are working on all of them, but there are a fair amount of problems, and we do need to prioritize which problems are going to get the most urgent attention from the programmers. So it's on our list, as well as many other things, and I anticipate them all getting fixed eventually. Some are going to get fixed a little quicker than others.
Thank you, Doc. And I know a lot of the fixes are going to be happening this weekend for folks to know. All right, if we update someone's profile in the pre-registration system, will they go to the end of the line?
Actually, that was something we found out did happen. However, that is getting fixed. That's one of our priority areas, is going to get fixed by the end of this weekend. That's what I understand. So that will no longer happen, and will not happen for anybody who's been registered. I've been reassured that if you're in our system now, you will be prioritized based on the date and time that you registered, and not based on any subsequent time you went in to edit or change anything. So that's good news.
All right. All right. Another question about the pre-registration. Is there any way to know if you received a call if your phone lists it as unknown?
Did you answer that question for me,
Yep. So,
Elise?
so I can answer for you, Doc. So what we would
Yeah,
suggest
thank
you
you.
do is just identify the number. So we have it listed on our website. We also have it listed in our press release. But you could be looking for a Massachusetts area code. So the phone number is 781-373-9800. And the text you're going to receive is going to come from a number that's 88911. And the email will come from St. Clair County Vaccine Distribution. So we're working on getting a local number to plug in there, but as of right now, it's that 781 area code. Anything to add,
Thank
Doc?
you. I think we're looking to change that to a local number, are we not? I think that's another part, one of the fix-it lists on the list. But obviously, if you know what to look for, that's half the battle. Thank you, Elise. Thank you. There's a lot going on right now with this Everbridge system, so I'm relying a lot on my very competent staff. They're working very hard on this.
All right. If you listed 3 types of notifications, will Everbridge use them all to contact you? So phone, text, and email.
Yes, they should. They should work their way right through this, through each contact information until you respond.
Exactly. And once, just for folks to remember, once you respond, whether it be text or email, once you respond one way, it'll be logged in the system. So you don't have to go back to your email, go back to your text, right? Just the first one is logged, however you respond, and it's in the system. All right. All right, next question. When will CVS in Michigan get vaccines? Heard they will be helping give the shots. That could help many seniors.
Ask your, that's out of our control. I don't know. I do understand that there is a federal pharmacy program that's being launched this week. The amount of vaccine that's being distributed up front to Michigan is not a lot of vaccine, and it's going to be distributed throughout the state. So if there are CVS stores in our county that receive vaccine, it won't be many, but that will obviously be advertised, and people will be notified accordingly. We're not honestly privy to that information, unfortunately.
All right. All right. Another question from yesterday. I'm confused. The CDC just said if you've had both vaccines and you've been exposed, you don't have to quarantine. I thought you could still pass the virus.
Right. That's a good question. So we believe that after natural infection, or even with a completed full course of vaccination, that it'll be unlikely, obviously, for you to get infected for at least 90 days, and the data is still coming in for that. Now, with that said, we know that people will still get infected even with being vaccinated. It's not clear what that infection will do as far as how great the risk is for transmission. So this is the thing. You don't have to quarantine if you've been fully vaccinated and if you remain asymptomatic. Okay, so if you get sick, you start having symptoms, you still need to think COVID, you still need to get tested. Plus, it doesn't get you off the hook of wearing a mask, avoiding closed encounters, mixing households, all the other things that we're asking people to do to prevent widespread transmission of this virus. So this is one of those things where you have to weigh the benefit and the risk of quarantine. And quarantine causes a lot of disruption of the workforce, right? Of school, it causes a lot of problems. At the same time, it prevents exposure. So they're just making a compromise here with a limited amount of information and a fair amount of confidence that your risk of transmission of the virus is probably significantly lower after either a natural infection or vaccine for a period of time currently unknown, but 90 days is a pretty safe estimate. So whether it's going to be expanded or reduced, and by the way, this might change with other vaccines that come out. So if you're confused now, just wait. I would say it's always a good idea whether you're vaccinated, fully vaccinated or not, to make sure that you stay within the precautions that we've been harping on for a year. Trying not to go out. Don't go out if you're sick. Get tested if you're sick. Stay away from other people. And if you do go out, if you're feeling well, you want to be wearing a mask when you're in public. You want to be staying physically distant 6 feet away from other people. Those are the ugly truths, people, and that's what we're going to have to keep doing for a long, long time.
All right. This next question is a pretty good question. Are you doing any tracking of COVID long haulers? Seems like there isn't very much information locally for those who are diagnosed to get information or support.
It's a good question, and we do know that there's COVID long haulers, and we do know that there's some long-term implications of a COVID infection, natural infection. There is stuff going on out there, but I don't have a place to tell your doctors to submit information to if they have, if you're working with them and having ongoing symptoms. There is not that I know of. Is there a central database process yet where they're collecting that information? I think they're talking about it, but I think everyone's so busy trying to deal with the pandemic itself that this kind of information is going to be a while before we get to it. There's a lot of very interesting papers based on small numbers of people, but I have not seen like a nationwide database on this yet.
Okay. All right. The next question. Were the allotments for seniors this week only for Marine City? Is the schedule 1 week in Marine City, next week in Port Huron?
So we facilitated the Marine City clinic. By the way, I'm just going to say that whatever vaccine we receive, we distribute as best as we can. And we use community partners. We have a couple of vaccination partners right now that are finishing up the schools and 1Bs. And then we started the Marine City clinic with the understanding that this new scheduling system was going to be problematic. And we were still, to my staff's credit, our staff's credit, we're able to still distribute over 500 vaccines yesterday at Marine City, which is absolutely phenomenal, knowing that we didn't know what was going to be happening with that. So the question is, where are we going to be next week? And we have not made that decision yet. We would like to be in the same places every week, but we don't always know how much vaccine we're getting in. So you guys are going to have to hold off just a little bit more until we come up with that decision. I'll be very transparent. We're struggling with this system to use it for scheduling, and we want to make sure that all the vaccine we get is utilized, and we're going to try and find the best way to do that next week, which may not be the way we finally settle on once everything's working well.
All right. And Doc, just to clarify.
Non-answer, wasn't it? Sorry.
Just to clarify, the clinic in Marine City wasn't just for Marine City residents. It's for the whole county, correct?
No.
No.
Yeah.
Okay. Perfect. All right.
Unfortunately, it does require people to drive all the way down there, so it probably did inadvertently attract more people from the downriver area, which is good because our other clinics have kind of consistently been up the Blue Water Convention Center, which is kind of serving most of the people in the urban northern area. And by the way, I haven't forgot about you, all you people out in Yale and Capac. We know you're there, and we feel obligated to get out there as well. So it's hard when you only have a small amount of vaccine to try and spread out. When we have enough where we can do one in each area, that is certainly our plan to do that on a weekly basis. But right now we don't have enough.
All right, next question. We're just running through some of the ones that we had last night, and then I'll hit the live questions. So has anyone that you are aware of gotten COVID after receiving both doses of vaccine?
Fully vaccinated? I'm asking our data guy. Because I know we've had cases of COVID after people who've had one dose of vaccine.
We've had cases where someone's got their second dose. Their exposure happened before their second dose.
There you go.
That 1 week.
So the answer is yes. We have identified cases, but when you dig into the details, their exposure occurred prior to when they were fully vaccinated. And remember, your full immune status, going back to the gentleman or someone's question about being exempt from quarantine after vaccination, you have to be 2 weeks, 14 days post your second dose to be considered fully vaccinated. And that's because that's how long your body takes to mount that full immune response. So if you get exposed to the wild virus 3 days before your second vaccine, you're still vulnerable, and much more vulnerable than you would be a month later. My dear brother is both his whole family, after one dose of vaccine, they both have wild COVID. So that's unfortunately the situation.
All right. Next question is a pretty common question about how many doses is St. Clair County receiving per week?
An average of 1,000.
First doses.
First doses. Now, that's first doses. The state also sends us second dose allocations based completely on what our first doses were in the previous 3 to 4 weeks. So 3 weeks if it was Pfizer, 4 weeks prior if it was Moderna. So those are not things that we order. In fact, we don't order the first doses anymore either. They just send this to us based on a calculation, a formula that they've used that includes our population and our social vulnerability index. And they just kind of divide it between all the counties that way. But I would say average, it's been about 1,000 doses for the last 3-4 weeks. Yeah.
All right. We're going to jump into the live questions now. Okay. First one, if someone missed their appointment, do they just get put back in the queue, or do they need to do something else?
Elise? I think they get put back in the queue. I don't know the answer to that question. They do get put back in the queue? Okay. So then you would have to wait for being called to your next appointment. Would it benefit them to do anything else?
No.
Okay.
Our understanding is that they go back into the queue into the same spot online.
Okay. So our understanding is if you're supposed to be at that clinic and you don't show up, your name would get put back into the system, into the queue. At the bottom, unfortunately, probably not back at the top.
So if they miss the call,
right,
or don't respond in the time,
yeah,
they go back into their original spot.
Okay.
If they don't show up and they're listed as a no-show,
they go down.
They go down. And
that makes sense. So in case you didn't hear Lauren, she said that, if you get a message from us, a notification that you have an appointment, and you have an hour to respond. And if you fail to do that response in an hour, your name will go back into the queue in the same place it was originally. So you don't lose your spot in those situations. You'll get picked the next time around, almost guaranteed. Okay. So that's the good news about that. But if you were scheduled at an appointment and didn't show for that appointment, I think then your name gets put back in and it ends up at the end of the list, or at least not at the top of the list. I'm not sure exactly why. But that's what I'm being told.
It's marked as a no-show.
It's marked as a no-show. Okay.
Yeah. We're working out some of the bugs.
Can I ask you a question? This is my question to Elise and my operational staff. So if you all of a sudden realize that you can't make it, would it benefit for them from calling so that we can make arrangements so they don't end up in the no-show section?
I did have this happen yesterday.
Okay.
And unfortunately, when the clinic is live, we can't do anything with appointments in the system.
Okay.
So we have to wait for it to be over for us to look at who didn't show up.
So the answer is we don't have a really good answer for this yet. And again, your best to show up.
Yeah. And Everbridge,
or make sure you let us know before the day the clinic goes live. Because what I'm hearing is once the clinic's live, it's really hard to go back into the system and do anything. So if you know a day ahead of time that date's just not going to work anymore, that would probably be worth a call or an email. And I think we're preferring people to send us emails, right? Isn't that easier for us? The phone system's still pretty overwhelmed. So send us an email if you can at that COVID-19 at stclaircounty.org, which does get checked every day. Every day it's got hundreds of emails in it, but we can keep up with that, where sometimes, as you know, the phones get so overwhelmed that you can't even leave a voicemail, and that gets to be tough. So we're working on that too.
I'm working through these questions, but we have a comment. Received my first shot yesterday at the Washington Life Center. Wanted to say it was a very systematically run program. Good job, health department.
Thank you. We're trying. Yesterday was, like I said, I honestly thought it was a little more chaotic yesterday than most of our clinics. If you've been to any of our clinics, you know, they run like clockwork. We do a really nice job with that, but we'll get there. And we really do want to make sure that the experience for you is not only as pleasurable as KB, but we want to reduce risk of you going into a large congregate setting. So I just want to remind people, when you go to our vaccine clinics or any vaccine clinic, please stand and wait 6 feet apart from the people in front and behind you, and make sure you're wearing your mask. We just need everybody to follow those rules, because it's possible somebody in there waiting is pre-symptomatic with COVID. I mean, we don't want sick people to come in, but these things happen. So I just want to remind everybody to do your part when you show up. And thank you, everyone. You did a great job cooperating.
Yeah.
Go ahead, Elise.
Yeah, and I'll just reiterate, if people could just remember to come at their designated appointment time. We had some folks yesterday who come maybe at 2 when their appointment was at 2:30. That can create some bottlenecks. So please come at your designated time. We have a dose reserved for you, and we're ready to go at that time.
And that's really important, because we do have we don't schedule clinic. That's why we don't just send out 1,000 appointments and first come, first serve, because we don't want people all crunched together, putting yourself and other people at risk. We want this vaccine clinic to be as low risk as possible for transmission of this virus. So that's a great comment. And we do it. If you've been given an appointment for that clinic, I don't want to say I guarantee you, but you can be pretty confident we have that vaccine for you, and you're not going to miss out.
All right. Let's go through some more questions. If your registration order was changed due to logging back into the system, will you get put back into your original place in line?
Yes, that is my understanding, that is supposed to happen by the beginning of next week. That is my understanding.
Okay. All right, next question. Did Lansing ever share the details on the new vaccine allocation formula based in part on social mobility factors, as mentioned several weeks ago?
Yes, they did. They did finally release where we are. And as you would suspect, St. Clair County as a whole does not have a really high social vulnerability index. We're not the lowest in the state, but we're certainly not the highest. We have sections of our community that would probably be higher, but they don't calculate that based on sub-communities. It's based on the community as a whole. So we're not getting any bonuses based on the SVI.
All right. Next question. Has our county had any cases of the new strain, and are we testing for it?
We are looking for it, especially in situations. In fact, I know we're dogging this down in situations where there is kind of an epidemiological link, where it might be a higher risk, where we really go after these people and try and specifically get extra specimen to send. So yes, we're looking, and no, we have not found any at this time yet.
All right.
Don't be surprised
just
if we
some more
get those people. I'm just saying right now, this variant is quite a bit more contagious than the other ones that have been circulating for a while, which means it's really probably just a matter of time that it becomes the more dominant strain. So it won't be surprising at all to see that we have this strain in our community.
Okay. And again, can you just reiterate with people, they're still concerned about the editing of the pre-registration system. Will they lose their place in line, and is that issue being addressed?
The issue is being addressed. I have been reassured that by when it is fixed, which should hopefully be early next week that everyone who's registered will be put in line based on the date and time that they registered and created their account, and not based on any subsequent edits that they made. So everybody will be put back in queue. I've received a couple emails from many of you that like went and looked for some further information and went back in and then realized that they lost their place in line. That will all be rectified, I am told.
All right. Why was the lottery system not used based on daily enrollment as opposed to rewarding those who are quick on computers?
My honest answer is because it's one more level of stuff that we would have to do, and we don't have time for that. We just needed a system to get people in so that we could just do the vaccination process and work on what we have to do. Now, I can tell you this. We're going to continue to work with special populations through different community groups where we can offer vaccine outside of this kind of large, 7,000 people who are waiting in line. But we're going to continue to try and chip away at individuals who don't have access to computers, who don't have access to transportation. We know that there's people out there that just aren't going to get to the front of the line. Those of you who were smart enough to get to the front of the line, I can almost guarantee you're at the front of the line on the Myers list, that you're on the McLaren list, and you'll probably have access to the CVS's and the Kroger's of the world that are going to be vaccinating soon as well. So I don't have any problem with you guys just getting out there and getting done what you have to do. We'll focus on the people further down and keep trying to provide special clinics where they have easier opportunities. And I know there isn't a single solution that we can come up with that's perfectly fair. And I'll say that right now. We're trying to focus on equity and make sure that certain populations don't get an upper hand on others. But I can tell you that no matter what decision we make, there's just no such thing as fair when you have 7,000 people who want a vaccine and you're able to distribute 5 to 900 or something like that a week. So we hear you. There's lots of ways we could do this. This is just the way I think we've chosen to do it. Number one, because we think it's the fairest we can do, but also number two, there's a reality, there's an operational reality of what we can pull off with all the different things that we have to do here. Remember, we're testing. We're doing all the contact tracing and investigations. We're doing all the data support and collection. We still are doing all of our primary mandated public health programs. So you can still come here and get tested for infectious diseases. So we do have a limitation of how many times we can change up a system and do things. That may not be the best answer in the world, but it is the truth. And we'll keep looking at that and looking and see if there's a better way to do it. Honestly, I really never thought of a lottery system, to be perfectly honest with you. Okay, let's throw that in there in the mix. But thank you. We'll keep that in mind, and we'll move forward as best we can.
All right. Thank you, Doc. Next question. I got called but was sent to Marine City. I live in Port Huron. Am I going to be called to go to Marine City again?
Oh, you mean for your second dose? Our second dose is always in the same place?
I think it was for her initial first dose.
Followed up with that and said he didn't go to that.
Oh, he didn't go to that one.
So we did get this a lot for calls this week. I live in Port Huron. Why was I sent to Marine City?
Well, you were sent to Marine City because that was the only place we had a general 65 and older clinic this week. Okay, that's number one. You are not going to be chosen to go to a clinic based on your zip code. We're going to select. So say we have a clinic for 500 people and we pull the top 500 people off this list. They're going to be offered that appointment. And if you decline it, then you'll go back into the queue and you'll get the next appointment for the next clinic, which probably won't be in the same place. I've already told you that we're trying to mix it up and have appointments both downriver, our city center, and then also hopefully back out in the rural community. We're just not able to do that every week in all those places. So I go back to your question. So I was called to go to Marine City, couldn't go. Did I lose my place in line? No, you didn't lose your place in line. And the next time you get called in to go, it may or may not be in Marine City. We haven't decided yet exactly where we're going to be next week, to be perfectly honest with you. So you'll be called, if you're in line, to go to whatever next available clinic there is. And if it's not to your liking, you'll get put back in the queue and you'll get selected for the next one, which will probably be in a different place, to be honest with you.
All right. So it looks like we have some more repeat questions of things we already covered. So I'm going to move on. Some more kudos to our staff and volunteers from yesterday's clinic. Good job to everybody who worked those clinics yesterday. Let's see. When will we be in the next phase for 16 to 65 with health conditions? So I'm assuming they're talking about phase 1C prior to group B.
Well, I'm interested in going to phase 1B group C, to be honest with you. We have a whole group of essential workers that we have been putting off. Manufacturing, agriculture, our government workers. There is a whole slew of them. And yes, I know some of them have slept through. We've gotten some of them vaccinated. But the reality is we are still officially only in the group B, 1B. So before we even get to 1C, the 16 to 64, we have to get that other group in. And I think that's going to be the first move. And I would like to see us have a little bit more headway with the 65 and older, at least get through at least half of them, but I'll have to say some of this is not our call. The reality is of public health, governmental public health. So you have at the national level, the ACIP and different organizations that identify priority groups based on the risk of COVID and all the other factors associated with the vaccines, et cetera. So that came out. And then the state took that information and they came up with their own priority list, which is what we're following. Through the Michigan Department of Health and Human Services, they've identified this group that we're currently doing as the priority group. We have some local municipalities, especially some of our larger cities, township or counties, that are kind of going off a little bit now and doing some of their own stuff. And that's fine, but I think as a whole, we're all trying, all of the health departments, the local health departments are trying to kind of stay in the same lane so that it's as fair as possible. And with the discussions I've had today with my colleagues, we're all still really far behind just with the priority groups that we're at now. I mean, you all are saying, how come I can't get vaccinated? I said 7,000 people already that are currently eligible that I can't give you a date for your vaccination status. I'd like to see that to be in a little better place before we opened it up to even more. So that's my stand. If the state turns around and says next week that, okay, we're opening it up, we'll do it, but it doesn't really put us in a better situation. I mean, we can't do any better job with what we have. So that's a non-answer for a question that's a really good question. And I don't mean to be blowing it off, but honestly, all I can say is that we're going to just kind of keep working away at the 65 and older. You know why? Because the 65 and older people are the most vulnerable overall. This is where we're seeing most of our deaths, where we're seeing most of our hospitalizations. And I think they deserve the most attention as we go forward until we feel like most of the people have some idea of when they're going to get their vaccine. That's what I think.
All right, Doc. So we have a lot of questions left on the feed. So let's rapid fire if we can. Why are so many people having ill effects after the vaccine compared to other vaccines?
Oh, so I'm not an immunologist, so I can tell you that it's an mRNA vaccine, so it's a different type of vaccine, and that may have something to do with it. I know that there's always been a fair amount of historical difficulty with making an effective coronavirus vaccine, so I suspect that our immune response had to be robust like this to make it work. If that makes any sense. A vaccine doesn't do any good unless our immune response kicks into gear. And this virus, the other thing I'm going to say is this virus is a weird virus. It does things to our immune system, this hyperimmune complex stuff that it's doing, that really, I can tell you in 30 years in practice, I don't recall the commonality. So viruses have always kind of been associated with some weird things, right? Post-viral encephalitis. So these uncommon, strange events. But this COVID virus does it a lot. And we still are trying to figure out why people 4 to 6 weeks later are having myocarditis and diabetic control issues. There's just a lot here that I think we still haven't quite unraveled. Now, whether that has anything to do with the high level of reactivity in this vaccine, it's hard for me to say, because again, I'm not an immunologist. It's a good question, actually. I might pursue it. Do you have an answer?
Most people have very mild.
That's true. Well, most people do have some mild, but you have to admit that there's more reactivity to this vaccine, I would agree, than we typically see in vaccines. On the other hand, this is a more effective vaccine than we typically see in vaccines. It's a highly effective vaccine, so maybe that trade-off is worth it. I think it's worth it, but I think there's still a lot to be told. So that more to come on that question. I think it's a really good question. I don't have a completely great answer for.
All right, next question. So how many vaccines per week are going to 65 plus?
Not talking about the essential work. We're trying to do 50% or more, and at least 2 weeks ago, and I think we're at 70% now, 60 to 70%. Okay, so that's kind of our goal. We were still really focusing on trying to finish up some of the teachers because we had made commitments there because the schools are starting. But I think now that that's kind of wrapping up, our focus is going to be that 60 to 70% range. And then the more of the 1Bs that we take care of, the more we're going to funnel over to the 65 and older. Not adequate. Oh. I agree. And how do you like my rapid fire answers? They're not very rapid fire, are they, Elise? I'm sorry.
That's
Keep
okay.
going. I got time. Go ahead.
Okay. So this next question is just asking, what about Port Huron seniors that live in federal housing for low-income seniors? And this person is a caregiver to their 89-year-old mother. The mother gets vaccinated.
That. And we are thinking about you. We are thinking about you. We're aware of those special populations. Like everything else, we're just trying to reach a point where we can put together a couple hundred vaccines and go there and do that. But you're on our radar. And it's funny you brought that up because we were actually literally just talking about that today, about trying to carve out some vaccine allocations for those special populations. But remember, every time we carve out a few hundred vaccines for that population, that's how many less that we could do for the general population, which is still really clamoring. So it's really hard. We have to keep robbing from Peter to pay Paul, which is tough.
All right. When you receive notification, what is the subject line or title you'll see? I'm assuming they're talking about the appointment invite.
Anyone know? I didn't receive a notification.
It comes from the St. Clair County vaccine distribution.
It comes from the St. Clair County vaccine distribution.
And I believe that's also the subject line.
And that's the subject line? Yeah. So there should be something in there about St. Clair County.
It will say St. Clair County and vaccine.
And vaccine. So the word is St. Clair County and vaccine, and maybe something else. I don't know. I'm sorry. We'll put that down. We'll have an answer for you.
Yeah, and for that person asking, just look for an email from St. Clair County Vaccine Distribution. That's going to be the email address it's coming from, okay? All right, let's try to get a couple more, and then we can wrap up.
I'm sorry, I'm not batting 1,000 here today, am I?
No, that's okay.
Where's Justin? I need Justin.
I'm 58 and have COPD. When might I be able to get a vaccine?
Well, you'll be eligible when we get to that 1C group of chronic disease, 16 to you will be before all population, general population healthy, but unfortunately just before. Everyone else is going to come before you.
All right.
And I can't tell you when. What does the state say about that group? They say May. I think the timeline the state put out said May for the rest of the essential workers and May for that group as well, right? Yes. So I guess that's what the state is thinking is somewhere around May we'll be able to open up to your group.
All right. Are the variants detected with the regular tests that are being administered now, or is that a more specific test that is needed to detect this variant?
So it's a specific test. Remember, there's basically 3 tests out there that you and I can generally get. You can get an antibody test, which doesn't tell you anything, and I wouldn't recommend that you waste your money on it. It does tell you whether or not you've had a previous infection, but that's about it. It doesn't tell you whether you're immune. And yes, if you get vaccinated, you should have a positive antibody test, but only if they do the right antibody test. So we'll get into that later. So then there's the antigen tests, the rapid antigen test, which typically are saliva or a nasal swab. And then there's the molecular tests, the ones that look for the genetic material of the COVID or virus itself. And that's also typically a nasal swab. And those can be rapid or sent to the state. Now, those are all tests for whether or not you have the infection. The genetic sequencing is done from the same type of swab, but they usually collect a second swab. And then they run it through a completely different set of testing material. And they, from my understanding, our State Bureau of Labs is running those on every specimen they receive, because most everybody does send a second swab. If you know, you've done swabs, so you can look from both sides. So that is a separate, and those tests take days to do. Unlike the PCR, which you can have done in 24 hours, comes back sometimes 3 days later. But the actual genetic sequencing, I believe, takes 5 days, isn't it? 5 to 7 days for a single specimen. It takes that long to just run the test. So there's a significant backlog. So it's not likely you're going to find out that you have a variant infection until you're probably already almost through your isolation period. Okay, and that's probably part of the problem. Is so you'll be finishing up your isolation period, and then someone will call you and say, "Hey, guess what? You've got the UK strain." It won't change things for you, but it will up the ante a little bit with the quarantine. We do want to try and identify those situations early so that we can, again, drawing that circle around it and really just trying to find anybody that could have potential exposure and is incubating the variant to slow it down.
Okay, let's do 2 more.
Quick questions,
if we have
right?
questions, if we have questions about appointment times or technical issues, who do we contact if we cannot get a hold of you? Can we contact the host sites?
What's the host
sites?
I can
answer that, Dr.
No, don't. Okay, you go ahead and answer it, but please don't call the host sites because they won't help you.
They can get a hold of us.
Okay.
It just might take a couple phone calls.
I still think the COVID-19 email is probably the best because
we've been able to get through emails.
We can get through those emails. I think calling is a little bit more problematic. We're still working on that hotline we talked about. We don't have anyone to staff it yet, which is part of the problem. We're working on staffing. So I would say the COVID-19 email would be the best approach.
We have twice as many staff on the email as we do on the phones.
Did you hear that? We have twice as many staff on the emails as we do on the phones. Is that true? Oh, okay.
All right. And so this will be the last question. Will vaccine appointment notifications for next week be issued tomorrow?
Boy, I would like to say probably. I mean, we're this close. I think we know what we're anticipating. I doubt we're going to get much more than 1,000 to 1,200 doses. We know where some of these have to be allocated because of commitments to where these are going. I think we just haven't quite landed on what kind of clinic to run, knowing that our system is still so clunky and it was so difficult to schedule people through it. So I would like to say tomorrow. And if not tomorrow, I would say Monday, because we did promise that we're not going to send out appointments other than during regular business hours, Monday through Friday. So you don't have to worry about checking your system on the weekend. We wouldn't do it. We wouldn't do it on Saturday or Sunday. Okay. So that's about as specific as I can get. Honestly, knowing what we're going through right now, I would say look on Monday. Look on Monday. And if you get it earlier, great, right? It's not going to change anything as far as who gets the appointments because everybody's in the queue. But there's another example. So if we fix this queue thing and we're being told it's going to get fixed early next week, it would be nice if that were fixed, right, first before we send out the appointment times. Otherwise, a lot of you guys who should be at the top of the queue have kind of been bumped down, and that's not really fair either. So a lot of variables here, including how big the clinic is actually going to be. What I can promise you is that every dose that we can distribute next week will get distributed. And we may need to have a couple of special clinics for special populations. And we've talked about this might be a great time to do this while we're shifting with this big system. And really maybe focus on some of those places that really don't have the ability to get online and schedule and do all the stuff you guys are doing. So, and you know what? I just want to say thank you for putting up with all this. It's not been clean and pretty, and we're getting it done. But honestly, it's been a struggle on your end and on our end. So thank you for being persistent. We're doing the best we can. We can always do a better job. I really appreciate some of the comments today and some of the thoughts about how to do this better. And just keep working with us because we do appreciate it, and we are trying.
All right. And before we sign off, I just want to remind people that if your question did not get answered today, you can always email us at the COVID-19 email, which is covid19@stclaircounty.org, if you can't get through with the call. And then also, a lot of these questions were asked earlier in live. So if you hopped on later, we have a YouTube channel as well, so folks can go look on our YouTube channel. We post this Facebook Live. We also timestamp it so they can see if their specific question was asked and answered. So that might be a nice tool for people as well. So Doc, any closing comments?
I mentioned thank you for being helpful and patient and kind to our rockstar staff. Honestly, I don't know. I can't say enough about how great they are. And I just want to say this, that with all the anxiety about vaccines, and the vaccines are important, and it is important that we get them into people's arms. But I want people to understand that that's not the only solution to your risk. You can still reduce your risk by the things that you do, by the places you go, and by the, wearing your mask and all of these things. They do work. So while you're waiting for the vaccine, just, stay the course. And I know everyone's just absolutely sick of it, but a vaccine is not the ticket that you need to kind of just go back and not pay attention to things. And so I just want to put that in perspective as we're waiting and as you're frustrated that the waiting is going to be a little bit longer, but keep doing the right things because it does make a difference. And it does help you out, and it does help your neighbors out. So thank you. We'll talk to you guys next week.